fulfilled.
I would have to say rewarding.
That one's hard. It gets hard to put in one word, but
Rewarding.
Rewarding.
It would be home.
Rewarding.
gratifying.
That would be adaptive. I thought long and hard about that word.
Family.
Definitely rewarding.
Education, only because I learned so much from the very beginning.
I don't even recognize it's been 30 years.
This is home to me.
You just don't, because it becomes part of your family. You recognize the people that you started with, and they're still here. You recognize the culture, and it's still here.
So I graduated, I was really young, 21.
I started here as a nurse aide, and I still have my badge.
My mom used to work here as a secretary.
And this was the place to come. They had just opened the new hospital.
I went to school at USL, and I decided to come back home.
Started typing birth certificates and typing, not computerized, typing birth certificates when I was like 16.
Scene was 1995. Way back when in the ancient days, there was a newspaper. You looked at the newspaper to see what jobs there were.
My counselor at the community college where I was going referred me to Terrebonne General.
I was 21 when I started here.
There was the blind box ad, didn't know where I was applying to, and it turned out it was Terrebonne General.
Decided to come to Terrebonne General. I had an aunt who was working on oncology.
When we got out of nursing school, most of us either came to work here or somewhere else, and I decided I wanted to be here close to home.
In 1995, I was in nursing school. I applied at Terrebonne General, and I was hired as a nurse extern on telemetry.
I worked in retail for a number of years. I was ready for a change.
When I graduated from nursing school, moved to Baton Rouge right after.
Went on interview and lo and behold, I've been here for 30 years.
I decided to go to Delta College.
Then I decided I was going to go to nursing school. And here I am, 40 years later.
The position at Terrebonne General and admissions came up, and I applied, and I've been here ever since.
I started my career here in materials with Miss June Davis, who was a wonderful person to work for.
And I went back to Lafayette, stayed, subsequently got married, and moved away to Georgia for, I guess, almost 10 years.
It's not like I planned to stay here. It just happened. I never had a reason to leave.
So as a nurse, I did bedside nursing, but there were so many more opportunities. That's why I decided to stay here and just see how I could grow.
I was able to work on the med-surg floor because I had been a student there, and I really enjoyed the nurses that worked there, and I knew I could learn from them.
Circumstances changed, and I ended up moving back home.
And then the opportunity presented itself for us to come home. My husband's from Louisiana, and he said yes. I said no. And so we ended up coming back.
Been here ever since 1985.
I had an opportunity to work on the skilled nursing facility as a charge nurse.
We determined that it might be a great place, and we had a 3-year-old at the time to raise our children and be near grandparents, and it's something we've never looked back from.
And then I transferred over to the nursing information systems.
There was always some challenge. There was always some opportunity.
From there, I then transferred over to the technical side.
I've had 6 positions here, so some people, I can't keep a job.
I worked at an infusion center for 17 years, and I became infusion nurse certified.
And then made my way over to the rehab unit as their clinical coordinator.
I went to case management for a while and then IT.
Now I work in the IT department. I'm an application specialist.
So was it a plan? No. Did we always say that there's something else to give and we can continue to do something with the people here and the community here? Yes.
Just as the hospital has built their foundation and continued to grow, I've kind of done the same thing.
The advancements, the technology, the ability to advance.
Step out on that ledge a little bit and see what's going on there and how you can improve yourself and help the organization at the same time.
Being a senior VP at Terrebonne General, starting here 40 years ago, I never would have imagined that.
I've learned a lot since I've been here.
I've learned a lot, over the years and from a lot of great individuals.
It's exciting, to be able to learn from others and then teach them what you know.
Once upon a time in my early days, I did the budgeting, and it showed how all the pieces of the puzzle come together for the medical center to operate. And I've seen that firsthand working in quality and finance, how everything has to align for us to be successful in this organization.
I can think back just in surgery how many things have changed from the time I came to now.
Amazing how now everything has gone paperless.
Cardiology, specialties, it's right here in our backyard.
It's just rewarding to see the differences and different surgeons, their new techniques and things that we've all learned.
There's just so many great experiences.
We've added Cancer Center. We've added the Women's Center to the front yard. The East Wing, I was here for that. I was here for critical care when it opened up. So a lot has happened during 30 years, and it's only the beginning.
Why go anywhere else?
My first day as an extern in critical care, I walked through the doors not knowing anyone in the department, and I hear extern, and I look over and they're coding someone. I go into the room, start chest compressions as I was directed, and that's how I learned my critical care family.
I think everyone that you come in contact with, you develop that camaraderie and you just feel like you're part of a family.
The culture here is amazing. It's family. We have multi-generations of people that are here, a very strong history.
It's just so many fond memories.
People that you work with forever and they become family.
I've had fabulous bosses. I can't say enough about the leaders at Terrebonne General.
Our community is my family, and coming to work is coming home.
The people, definitely the people is the culture. People say it lightly, but it's true.
You know the people who are taking care of you. You know the people who are across from you. You know that friendly smile.
The relationships you build with not just your coworkers, the physicians, everyone.
I can't really pinpoint one specific thing. It's just been a multitude of things, and it's happy times.
Early on when I first started, the cardiology program was just starting.
It was very challenging. Nobody here had ever done heart, so.
I was the critical care nurse assigned to taking care of the first heart patient that we did.
I was one of the people that worked in critical care, one of the nurses that was selected.
I remember waiting for the patient to come out of surgery. I remember putting my stethoscope in my ears and tapping on the bell, the diaphragm, to make sure it was working. And another provider saw and busted out laughing. It was so exciting. And at Terrebonne General, there's so many of those first time exciting moments.
Fondest memory would have to be meeting my wife. And she worked in respiratory. We got to talking, and everything else is history after that.
The Christmas parties, that was fun.
In 2010, I was selected as one of the Great 100 Nurses of Louisiana.
In 2024, I was awarded one of the Louisiana Great 100 Nurses, which is an honor because you're nominated by your peers.
I was Employee of the Month. I was the very first leader of the quarter. I was a Great 100 nurse.
And that was very exciting to receive that award and have my family be present with me for that.
Employee of the Quarter back in 1996, and then again in 2019, the Employee of the Month.
In 2018, I was awarded CRNI of the Year.
For the most part, I like the people, the people you come in contact with, the patients, the families.
It's all about the patient. That's the focus it's always been.
Remembering the physicians back in the day when we had a 10-bed critical care unit sitting at the bedside with me while I took care of patients.
I had a big connection with the patients and their families, and that's touching.
And those memories, are, to me, what my nursing career was all about.
Each day is a challenge, but by the end of the day, there's at least one or two things that you can point out that rewarded you, patients, the other team members.
A lot of people come in and they've been in doctor's offices all day. You know, they be a little irritated. But if they come in, they see a smile on your face, a pleasant attitude, that kind of helps them to calm down and the experience be much better for them.
My biggest accomplishment out of Terrebonne General, of course, is your family, because it's really hard to juggle these kind of roles in a family too, and they have been extraordinarily supportive.
You spend more waking hours than you do with family.
In my role, I always want to make sure I can look in the mirror in the morning and make sure what I did was okay.
I take pride in the fact that I started my career here at Terrebonne General as a nurse, and I've actually had the opportunity to see both my son and my daughter, who decided to go into nursing as well. Not persuaded by me, but on their own volition.
I had my kids here. My son now works here. He's in nursing school.
I was born here, raised in the community. My children were born here, and actually now I have a couple that work here.
My biggest accomplishment here is Hurricane Ida. That always gets me emotional and prideful, because we got hit pretty hard, and you had people coming out the woodwork to help. You had staff, you had physicians, you had community members, you had everybody say, what can we do to get back on our feet?
And it just seems like no matter what the challenge is, we're able to overcome.
And we had a goal that we were not going to be down, and in less than 30 days, we were up and running and at full steam ahead. That takes a village, but it takes a want and a drive. And if I retired tomorrow, that would still be my finest hour. Not mine, y'all's. And it's amazing.
40 years ago, it was nothing like it is today. But it was great that I've been able to have those memories to see it grow.
Only place I've ever worked as a nurse.
One day is not like the other.
I just enjoy, working with everyone, and
I love Terrebonne General. It is like home to me.
I do enjoy coming to work, and
I've had the opportunity to be here another 30 years and be in a variety of positions, but I never want to forget the people that did it long before I was here.
Overall, it's been a great experience. I wouldn't trade what I do for anything in the world. I love what I do.
It's been rewarding. I've really enjoyed my time here at Terrebonne General and hope to see many more years of it.
It's a great place to work.
I've loved 30 years, and hopefully I can continue to serve in whatever capacity that comes my way.
The leaders here, if you look around, there's longevity.
I know I don't have another 40 years to give, but right now I love my job. I love what I do. I love the people I do it for.
I love what I do.
Terrebonne General is an amazing place, but it's an amazing place because it's one pillar in an amazing community.
I'd like to continue as long as I feel that I'm effective, because I feel like I do make a difference. And together we all make a difference.
I'll always have that place in my heart for Terrebonne General.
For me, I feel like Terrebonne General is the place to be. No, I'm ready for bed. You could add that to there too.